disorders of the female genital tract, and today we will discuss diseases of the cervix. And the two common diseases of the cervix include the inflammatory conditions known as the cervicitis, and the other conditions are the cervical intraepithelial neoplasia, which can lead to cervical cancer. Now, cervicitis is the inflammation of the cervix. Now, this inflammation may be specific or non-specific. It may be uh, caused by infections, or it may be uh, due to other conditions. But the most common causes of the uh, inflammation and infections of the cervix includes bacterial causes like Neisseria gonorrhea, uh, which is a bacterium, Chlamydia trachomatis, and Strepto and Staphylococci E. coli and other organisms that form the non-specific infections. The viral causes of the cervicitis includes the herpes simplex virus, the human papilloma virus, which commonly causes cervical cancer, and the common parasitic cause of cervicitis is the Trichomonas vaginalis. But here, one thing important is that uh, when we diagnose the exact cause of the cervicitis, there are difficulties because the cervical canals many contains the normal flora, which may have many uh, microorganisms, and therefore very care should be taken to make a conclusion. The cervicitis usually results in abnormal vaginal discharge in the form of leukorrhea, but it is dangerous during childbirth because when the child passes through the birth canal and through the cervix, the common diseases that are caused by the infections that cause cervicitis includes the neonatal conjunctivitis and pneumonia. Now, before we discuss the cervical cancer, let us briefly discuss the anatomy and histology of the cervix. As we know that cervix is a part of the female genital tract, and we divide the organs of the female genital tract into internal organs and external organs. The internal organs are the ovaries, fallopian tubes, uterus, and the cervix. And the vagina is included both in the internal and external parts, and the external parts others are the clitoris, vulva, vagina, and the mons pubis. Now, going into the histology of the cervix, we divide the cervix, which is the lower part of the uterus and the one that protrudes into the vagina, into two parts. The part which is closer to the uterus is known as the endocervix, and the part which is close to the vagina is the ectocervix. Now, internally, the cervical canal, the endocervix, it is lined by columnar epithelial cells that produce mucus. And in between the endocervix, which is lined by the columnar epithelial cells, and the ectocervix, which is lined by the mature squamous epithelial cells, there is a central zone which is known as the transformation zone. And this transformation zone contains the subcolumnar reserve cells. And normally, continually these subcolumnar reserve cells, they undergo metaplasia and mature first into the immature squamous epithelial cells and finally into the mature squamous epithelial cells. But this process depends on that how much squamous epithelial cells are shed or lost from the ectocervix, so that new cells are formed by the metaplasia from the columnar epithelial cells and shifted into the ectocervix. Here, one important point is that is to remember is the cervical cancer and the cervical intraepithelial neoplasia. These are the most common cancer in the women, and they are usually caused by the human papilloma virus. Now, how the human papilloma virus induce cervical cancer? As I said, that the endocervix, which contains the columnar epithelial cells, and in between the ectocervix and the endocervix, there is a transformation zone where the subcolumnar reserve cells uh, uh, lie, and these subcolumnar reserve cells, they multiply and transform first into immature squamous epithelial cells, and then these immature squamous epithelial cells are stuck in the G1 phase of the mitotic cell divisions. And it is only when the new mature squamous epithelial cells are needed, these immature squamous epithelial cells then mature, and they pass through the G1 phase of the mitotic cell division into the M phase, which is the metaphase. So the mature squamous epithelial cells, they lie the ectocervix, which is the outer part of the cervix, and when we examine through the vaginal speculum, we can see the ectocervix, but we can't see the endocervix. Now what happens, that this process is normally controlled by certain genes, but when the cervical cells are infected by the human papilloma virus, these viruses produce certain proteins known as the E6 and E7. And these proteins, what they do, they suppress or block the P53 gene. And this P53 gene is the tumor suppressor gene. And normally, when the columnar epithelial cells go from G into the M phase of the cell cycle, these tumor suppressor genes inhibit the transformation, and the cervical immature squamous cells, they are retained and stuck in the G1 phase, and it is only when these cells are needed, when the mature squamous epithelial cells are needed, the immature squamous epithelial cells are allowed to divide and provide the mature squamous epithelial cells. But what happens, that the proteins known as the E6 and E7, which are produced by the human papilloma virus inside the cervical cells, especially the immature squamous cervical cells, they will block the tumor suppressor gene. And when this suppressor gene is blocked, what happens, that the immature squamous epithelial cells are allowed to divide. And this will lead to the uncontrolled mitotic cell division. And first, these cells becomes dysplastic. By dysplasia, I mean that they have disorganized structure. And this condition, when the cells are dysplastic, it is known as the cervical intraepithelial neoplasia. So when you are asked that what is cervical intraepithelial neoplasia, you can say that dysplasia, which is a stage through which the cells pass before becoming cancerous, the the cells, they are disorganized. So this stage is known as the dysplasia, and the dysplastic cells are the cervical intraepithelial neoplasia, and cervical intraepithelial neoplasia is a fertile field for the carcinoma of the cervix, which may progress to cervical cancer. Now, normally the subcolumnar epithelial reserve cells of the endocervix, they undergo metaplasia. They are converted into squamous epithelial cells of the ectocervix, but they are stuck in G1 phase. And when allowed, at the time when cells are needed, what happens, that the one cell will undergo mitotic cell division and will form two identical normal cells. But in conditions where the human papilloma virus proteins produce proteins E6 and E7, and these proteins, they block the tumor suppressor p53 gene. The cells are allowed for uncontrolled cell division, mitotic cell division. And what happens that now the uncontrolled cell division will result in the formation of lot of cells with which are disorganized and are not like normal cells, and they have certain figures like abnormal nuclear cytoplasmic ratio and disfigured nuclei. So this is dysplasia, and this dysplasia of the cervical squamous epithelial cells is known as the cervical intraepithelial neoplasia, and it can progress to the cervical cancer. Now, as I said, the human papilloma virus use the cervical cells uh, nucleus and DNA to form the E6 and E7 proteins, and that will suppress the p53 gene, leading to uncontrolled replication. And these cells, disorganized cells, they are resistant to the apoptic cell death and will cause the cervical intraepithelial neoplasia. Now, there are more than 100 types of the human papilloma virus, but only about 16 types they are involved in causing the cervical cancer, and of them the human papilloma virus 16 is very notorious and, famous for causing more than half of the cervical cancers. Usually the cervical cancer starts in the basal layer of the transformation zone. Now, we stage cervical cancer according to the depth of the cervical wall that is involved by the cancer. When only the lower one-third of the epithelium is involved, we label them as grade 1. And when two-thirds is involved, we label them as grade 2. And when almost all layers of the epithelium are involved, we say this is grade 3. And when the entire thickness of the cervical wall, including the epithelial layer and stroma, connective tissue layers, we say carcinoma in situ. But once the cancer cells leave the cervical wall and enter uh, into the other organs and leave the cervical wall and go into the surrounding tissue, now we will label it as the invasive cervical cancer. And when we examine under the microscope histologically the cervical epithelium, so more the cells are dysplastic, more there is the risk of developing into cancer. Then the cervical cancer, first through local invasion, metastasize into the pelvic organs, and it can spread through lymphatics, and hematogenious spread through blood into the liver, lungs, and other organs of the body. Now, mostly in the cervix, two types of cancers occur. One is the squamous cell carcinoma, which is the most common, but uh, additionally, in some cases, though it is rare as compared to the squamous cell carcinoma, there is the cervical adenocarcinoma, and it commonly involves the columnar epithelial cells, and uh, these cells, they secrete mucus. Now, one important thing here is important to remember that the time from HPV infection to the cervical cancer, it is a long time, and it takes 10 to 20 years before the cervical epithelium goes into the cervical intraepithelial neoplasia. And there are some risk factors, particularly the human papilloma virus infection, which is a sexually transmitted disease. And human papilloma virus, mostly it is sexually transmitted, and the risks are higher in people with unprotected sex, and types of the human papilloma virus like HPV 16, and the length of time, that for how much time the infection occurs, and those people who have a weak immune system and are immunocompromised, and certain environmental factors may also play a role. Now, it is not necessary that each and every patient which is infected with human papillomavirus will develop cervical intraepithelial neoplasia and the cervical cancer. Because our immune system normally it will fight the viruses, and uh, they are not allowed to replicate and to go into the cervical intraepithelial neoplasia and cervical cancer. But if any condition that uh, interrupts and weakens the immune system when we say that the person is immunocompromised, so they are at high risk of the intraepithelial cervical neoplasia and cervical cancer. Now, the symptoms, the most common symptoms in uh, cervical cancer is the abnormal vaginal bleeding, and particularly with the vaginal bleeding is noted after sexual intercourse. And other symptoms, they include the vaginal discomfort, vaginal discharge, usually foul smelling discharge if infection is there, or when superinfection with bacteria occurs. So the vaginal discharge will be having an unpleasant smell and pain when the female patient urinates. Now, if the cancer spreads beyond the cervix into the gastrointestinal tract and other organs like the kidney and urinary bladder, it can cause constipation and blood in the urine. Now, fortunately, there is vaccine available for prevention from human papillomavirus, particularly human papillomavirus 16, which is the most common cause of uh, human papillomavirus infection and cervical cancer. And this vaccination is very important, and the female patient should undergo the, this vaccination to prevent them from human papillomavirus infection and automatically the intraepithelial cervical neoplasia and cervical cancer. And the other thing that is must is the uh, pap smear, pepincollo smear. And the purpose of pap smear is that if we diagnose cervical cancer at an early stage when there is only mild dysplasia, uh, and if the dysplasia has not progressed to intraepithelial neoplasia and cervical cancer, at that time the treatment is very simple and easy. And these two things, that is screening for cervical cancer and vaccination of the cervical cancer, they are very important. uh, we can do cervical uh, colposcopy for taking the biopsy for the confirmation of the cervical cancer diagnosis, and for the pap smear we simply take the cervical cells by using a brush and to examine them under the microscope. Now, the treatment of the cervical cancer depends upon the uh, stage of the cervical cancer. Most often, when there is only dysplasia and the condition has not progressed to metastasis and invasive carcinoma of the cervix, the treatment is easy and it will be very successful. The cryosurgery, in which liquid nitrous oxide is used to freeze and kill the dysplastic cells, uh, can be done. And the other treatment option is the conization, which means that we surgically remove the transformation zone and sometimes part of the endocervix. And for conization we can use the cool knife conization, we can use the laser, and we can use the loop surgical excision procedures. But once the cancer has spread to other organs, then we are left with no options other than radiation and chemotherapy. So in the early stages of cancer, we can do surgery and it will be successful depending upon the stage of the cancer. But in case of metastasis and advanced cancer, we will use radiation and chemotherapy. Now, at the end, we summarize cervical cancer, that first of all, what happens that the mutations in the tumor suppressor p53 gene will result in the cervical intraepithelial neoplasia, in which the immature cells, squamous epithelial cells that are normally stuck at the G1 phase, they undergo uncontrolled cellular divisions and results in the disorganized dysplastic cells, and this dysplasia or the presence of this dysplastic cells, they this condition is known as the intraepithelial neoplasia. And intraepithelial neoplasia is a fertile field for the development of neoplasia and cervical cancer. And we all know that human papilloma virus is the most common cause of the cervical cancer, particularly the squamous cell carcinoma, and the other type of cancer that can happen but is rare is the adenocarcinoma, in which the mucus secreting cells are present in the cancerous tissue. The treatment options uh, include the cryosurgery, conization, and uh, sometimes surgical removal of the entire cervix, and if needed, other female genital organs. The two important things that we should remember is there is a vaccine for human papilloma virus, and uh, female patients from uh, 21 years to 65 years, they should undergo the Papa Nicolo test, which is known as the PEP test, in which cells are taken with the help of a brush and examined under the microscope, and then we can use cryosurgery, conization, and uh, other treatment options accordingly. Thank you very much.